If we can come back to the table, and I see everybody's having very animated conversations that are stimulated hopefully by our first presentation, as well as the fact that people are now seeing each other again. This is one of the great things about this meeting, is that come together and really have a lot to share between meetings. Coming back from the break, we've had a good start to the day, and now I'd like to introduce the speakers on this next panel. We have a panel of speakers who will focus on the current state of informed consent in research and treatment. I'll introduce all four speakers and ask again, after they make their presentations, that you hold your questions and comments so that we can keep moving along on our very packed agenda. First, we have Dr. Sarah Goldkind, who's a research and clinical bioethics consultant. She recently left the Food and Drug Administration, where she served as a senior bioethicist for over 10 years. In that position, she addressed ethical issues arising in cutting-edge research, such as informed consent processes, rare diseases, research on pregnant women, children, consent-impaired individuals, and emergency care research. In addition, she is an active member of the Walter Reed National Military Medical Center's Clinical Ethics Committee. Second, we have Dr. Sandra Quinn. I thought I knew that. Quinn. Dr. Quinn is the Associate Dean for Academic Affairs, Professor in the Department of Family Science, and Senior Associate Director of the Center for Health Equity at the School of Public Health of the University of Maryland, College Park. She's currently and has been principal investigator on a number of studies pertaining to health disparities in minority populations. Her research interests include engagement of minority and marginalized communities in research, vaccine acceptance, attitudes and communication, and risk communication in emergencies, disasters, and pandemics, with specific focus on minority populations and disparities. And then third, we have Dr. Yael Schenker. She is the assistant professor in the Division of General Internal Medicine section of Palliative Care and Medical Ethics at the University of Pittsburgh. Dr. Schenker also holds a secondary appointment in the Clinical and Translational Science Institute. Her research focuses on integration of palliative care services in oncology, surrogate decision-making, informed consent, and medical advertising. My notes here. She practices as a primary care physician and conducts palliative care consults at the University of Pittsburgh Medical Center. And then final speaker on this panel is Dr. Alicia Fernandez. She is a professor of clinical medicine at the University of California, San Francisco, an attending physician in the General Medical Clinic and medical wards at San Francisco General Hospital. Research primarily focuses on health and healthcare disparities, and she is particularly interested in vulnerable populations, Latino health, immigrant health, and language barriers. So with that, we have a really good panel here. Dr. Goldkind.